I am Alundrah Sibanda.
Babalanda Edmond.
My name is Olfa Chelbi.
And we are the co-founders of Shielded Africa.
Shielded Africa is a continental organization whose mandate is to fight against gender-based violence through a multifaceted approach that includes use of research, education, media, and facilitated dialogues.
We aim to inform policy and practice about effective ways to respond and prevent this issue.
All you have to do is look at the numbers. Some governments in Africa have implemented measures such as lockdowns and alcohol bans in order to stop the spread of COVID-19 and also curb lawlessness and violence. Yet the numbers of people still reporting instances of gender-based violence are staggering.
As governments are putting in place different measures to suppress COVID-19, we are currently witnessing an alarming increase in cases of domestic violence. In this time of crisis, it becomes even more critical to support and protect victims of domestic violence, as reaching out for help becomes even more challenging and even more dangerous.
Due to poverty, inequality, and unemployment, majority of the vulnerable people are locked up in homes with their abusers, where they have no say or input. This has worsened the situation of gender-based violence in Africa.
Through our research, we came to notice that the link between gender-based violence and COVID-19 was still uncovered by many countries. And even in the countries where the link between these two issues was being discussed, a lot remains to be done.
The pandemic has disrupted gender-based violence services, access to justice for the victims, survivors of GBV.
In Nigeria, the United Nations Population Fund published a set of guidelines for a humanitarian response to gender-based violence during the fight against COVID-19. In South Africa, under the national lockdown, the Gender Commission provides the essential service of referring complaints of gender-based violence to the appropriate authorities. This ensures that there is access to justice.
Some governments have put in place hotlines running 24/7, but there is still a lack of access to essential facilities and services, such as hospitals, shelters, and legal services because of this pandemic.
In Zimbabwe, the work of non-governmental organizations which deal with gender-based violence, such as the Musasa Project and the Adult Rape Clinic, is permitted to continue throughout the country's lockdown period. The narrative around COVID-19 is that it does not discriminate, and this is true. And in the same way, anyone could be facing gender-based violence. So staying alert and understanding what constitutes abusive behavior could be the difference between saving someone else's life or even yours.
As governments endeavor to put in place strict measures to flatten the curve, a robust plan should be designed so that victims can access the gender-based violence services and also access to justice systems.
Emphasis on more discreet methods of reporting gender-based violence, such as texting and online communication, coupled with a guarantee that these reports will be taken seriously and survivors will be transported to designated shelters which are fully equipped with the hygiene essentials that they will need during this pandemic.
No matter the situation, you matter. Keep strong and don't give up. We are fighting with you, even during such hard times like these.
You are strong, brave, and courageous. But most of all, you're not alone, and we stand with you.
We care about you, and under every circumstance, we will continue the fight for a gender-based violence-free Africa.